Facebook, welcome to Back Talks, and YouTube, welcome to Back Talks. So good to have you here. Happy Wednesday. And we're going to talk about something that a lot of people don't know. So if you're in a position where you are considering back surgery or neck surgery, you're not going to want to miss today's live, because we're going to be talking about a real thing called failed back surgery syndrome with some new research on it that I think you need to know in your decision-making process, especially if a surgeon is telling you you absolutely have to do it and perhaps is scaring you or creating fear into your life. So I want you to know some of the real data that is very recent that I built yesterday and studied on it. So welcome. Great to have you here. If it's your first time, welcome. And if you've been with us for a long time, welcome back. Hey, make sure that you say hello, please. And if you have questions about anything, make sure you put them in the chat. And I hope that you'll love this presentation. And if you do, I hope you're going to want to make sure that you subscribe to our channel so that you always get the latest information that we put out for you. I try to put a lot of great information out for you to help you stay healthier and feel more vibrant. And make sure you hit the notification bell. That way, as soon as we put something out, you'll get notified that that we just made something specially for you. So, all right, let's get on with it. So let's talk about this. So what is failed back surgery syndrome? Well, for starters, it actually has an ICD-10 code right now. And if you don't know what that means that this is an official diagnosis that occurs that insurance companies understand and doctors can use. And so failed back surgery syndrome, ICD-10, that is the most up-to-date diagnosis codes. M96.1 is what they put on the insurance sheet, and what that means is that it is defined as back pain with or without sciatica, or that would be radiation as well, going down the arms, hands, and fingers. And sciatica, unfortunately, is usually a numbness or severe pain going down the buttock, leg, or into the foot that persists and recurs. And get this, it persists and recurs after a spine surgery. Well, how often does that happen? Well, up to 20 to 40% of patients Up to 20 to 40% of patients continue to experience persistent or recurrent pain after lumbar spine surgery. That's way too many. I mean, that's a ton of people, and you don't want to be one of those. Because trust me, once you do a back surgery, very few surgeons want to go back in and actually correct somebody else's work. And so this isn't good. What else do you need to know? Well, you need to know this, and that is around 10 to 46% of patients report pain after their lumbar spine surgery. And it's the leading cause of disability right now. Failed back surgery syndrome is one of the most common reasons for chronic pain disability in the United States. That's crazy. So one of the most common reasons for chronic pain disability in the United States. Weren't you going to get surgery so you were able to do stuff and not disabled from doing stuff? This isn't what's supposed to happen. And I don't want this happening to you. So if you're in that process of making decisions, you need to know this information. And because these are real numbers, I did a lot of research for this as well. So I want you to know these are legit numbers as of right now. And the crazy part is that the prevalence of failed back surgery syndrome, studies estimate that 10 to 40% of back surgery patients will end up with failed back surgery syndrome. Okay, I'm okay maybe 1%, 2%, but not 10 to 40%. That's an outrageous number. That's getting close to half of the people that go get back surgery. So if you are a person who's having chronic neck pain or back pain and you're being told that you need surgery, this is a real thing that you need to consider. What if I wind up with failed back surgery syndrome? This could be a disability for the rest of your life. And if you love living life and you're the type of person that doesn't want to live on pain medications and drugs and electrical nerve stimulators that are implanted in surgery after neck surgery after neck surgery, you got to be armed with this information so you can make good informed decisions. And that's why I'm sharing this with you today. So, and here's some interesting facts. And that is, repeat surgeries don't even improve the odds. So your first surgery is approximately 50% success. And I'll be honest with you, I've actually seen that in most cases about 38% for most people if you look at the real numbers. Your second surgery will be approximately 30% successful. If you have to have a third surgery, only 15% successful. And if you have a fourth surgery, only about 5% successful. So that's a very big difference. And we don't want that happening to you at all. And let's talk about the economic burden. So does this cost a lot of money? Yeah, it does. It really does. And I don't want you wasting your hard-earned money. You and your family go to work, you work hard, you save your money, and the last thing you want is to be spending a lot of it when your surgery was failed. And it's a real thing, and you need to be aware of it. And how much does it cost us right now? Well, the economic burden right now for failed back surgery syndrome contributes to billions in annual healthcare costs due to repeated procedures, pain management, lost productivity, and disability claims. That's a lot, people. That's a lot. We don't want that happening to you. So, do you have another option? Well, of course you have another option. And if you've been with me for a while, you know that, we're helping people all over the world, non-surgically, help get their back pain under control so that they can start living again. We have people in Indonesia, Hawaii, all over the United States. So, there are very successful options. And let me show you some proof of this. I think, this is really important to see. So, we can talk about it all day long, but I want to show you the difference in a MRI, in pre and post MRI findings. So take a look at this person right here. So this is a person that had severe low back pain, was told by 4 surgeons that he needed surgery, had sciatic pain, that's pain that goes down the buttock and legs and feet, very uncomfortable, very painful for some people, down to his foot, leg weakness, and couldn't move. So, when you look at this guy's MRI right here, you look at where the red arrows are, it's not good. Don't get me wrong, this is not a great MRI. But I want you to be able to see where that red arrow is, all that black stuff that's coming out. That's his herniation. And so this gentleman didn't want to have back surgery, so he came to see us, did our program. This 12 weeks later, almost no herniation anymore. And the amazing part is that it doesn't have to be, you don't have to suck all that disc material in back off of the nerve to create more normal function, dramatically less pain. This is a game of fractions of millimeters. It doesn't have to be all 100% perfectly healthy disc for you to have and function normally. Just got to take a little bit of that pressure off that nerve. Do we want to do more? Yes, because we don't want this coming back for you. So we're going to do everything we can to help bring that disc material back in, get it rehydrated, get nutrients back into the disc, get hydration back into the disc, get waste products out, prevent calcification of the end plates for you so that we have adequate blood supply getting into the disc to the best of our ability. We want to do all that stuff for you so you're not messing around with this stuff for the rest of your life. And you get to go on the vacation you wanted to, or be the grandparent and play with your grandkids and be able to pick them up and hold them without worrying about dropping them. That's a real thing. I've had a lot of my grandparents say that. I'm afraid to hold my grandchild because I'm afraid I'm going to drop them. And I just want to love on them, right? And just, maybe go back to work again so you feel like you're contributing to this world and to your family. And to your partner. Maybe go on that vacation that you guys just thought was never going to happen again. And now you're like, you know what? I can do it. I got a patient of mine right now going to the Hawaiian Islands, and she's so much more comfortable right now after doing our program for 2 weeks. I'm super excited for her because that's what you deserve to have. And she's a lovely person, and I love helping people like that. So if you're looking for a non-surgical option, I want you to know they're available, and I want you to hopefully see that this is living proof. I could put another 20 of these up right now, but don't want to bore you with all that. So I want you to know that it is possible to do this, okay? And I made this more of a joke than anything, but when a second back surgery only helps 30% of patients, it's no wonder why so many people like this lady is searching for a safer, drug-free, non-surgical option like we offer and what Disc University offers. So hey, Marisa, great to have you here. Hope you're having an amazing day. Stephanie, great to have you here as well. And you are so welcome. And it's my pleasure. It's what I love doing, is helping people who are looking for non-surgical options and show them that there are very successful ways of doing it. And we've created an amazing course. And if we feel like you'd be a good candidate for it, we'd love to share it with you. And I hope you know a little bit more and understand a little bit more right now about the real numbers on failed back surgery syndrome. You realize, like 10 years ago, there was no ICD-10 code for failed back surgery syndrome. But there's so many back surgeries taking place right now, and there's so many artificial implants that they're putting in. These things don't work all the time. And when they break inside you, it's a major mess. And you thought you had pain to begin with. Now you got to get a back surgery again. And there's scar tissue in there from them cutting. And most doctors don't want to do that. And you're going to be on your own. It's not the kind of life you want to live, right? You want to live a life of vitality, expression, letting your light shine, letting your beautiful spirit shine. And that happens when we have less pain. And we can create less pain in our back by doing the right things that the spine needs to stay healthy. And one of them is a decrease in compression, because most back pain is due to compression. And we'll teach you how to decompress your back. Okay? So would love to share that with you if you'd be open to it. If you would like, I'm not quite sure how this slide, but it's the picture got pushed away, but the information is there. I don't offer these very often, but if you or someone that you love would like to set up a one-on-one call with me, you can go to booking.drshawnmcwilliams.com, and there's an invite to my calendar. You can look at your schedule and mine, and you can book a time that you and I can talk about what's going on with your back or your neck, and what have you tried so far, and if you're a type of person that is looking for a non-surgical option. If you want surgery, go for it, get it. But I'm going to let you know, I've seen the success rates of it. It's not very high. Spinal decompression success rate is 80+%. Back surgery is usually 38 to 50%. Why wouldn't you try something for 12 weeks of your life that is way less expensive than back surgery? And you can do from the comfort of your home. Yes, all of my clients are fixing their backs from the comfort of their home. They don't have to schedule doctor's appointments. They don't have to worry about where to park at. If they're going to be late for an appointment, they got to leave their home and their dogs or their grandkids that they watch. Well, any of those problems. They get to do it on their own time from the comfort of their home. And we teach them exactly how to do it. And it's very successful. So if you're looking for something like that, go to booking.drshawnmcwilliams.com and make sure you get on my calendar. Let's talk and just have a real talk and see if we can help you, okay? I hope everybody had an absolutely amazing day. I appreciate you all. Thanks so much for being here. I'm sorry if you missed me on Instagram. It looks like they changed their rules for doing lives now, so we'll have to figure that one out. It's always a moving target with all these social media platforms, but we'll figure something out. But anyway, I appreciate all you guys. I hope you learned something, and if you know someone that's suffering, please share this with them and like it as well. Write me a comment. Tell me what you think about it. I try to spend a lot of, these programs, even though they're only 10 minutes long, usually take me about 4 hours at least to make. I try to have good graphics for you and try to have really good, pertinent, up-to-date information to add value to your life. So I hope that write me a comment, let me know what you think about it. And if there's something you'd like to know about it, let me know as well so we can do a live for you. You are so welcome, Stephanie. Have a great day. Thanks. Happy fall to you. I know it's supposed to get chilly this weekend. Is it starting to get cool up there? And oh yeah, and happy October 1st to everyone. It's the official Halloween month, so it's always a fun time. I know everybody looks forward to fall, especially up in Pennsylvania. It's beautiful with the leaves, and it's beautiful down here too. So I hope everyone has an amazing day. I appreciate you so much, and I will see you next week, same time. All right, bye you guys.